Hello, my dear friends. Myself, Richu Sebastian. I'm a BSc nurse with 7 years of experience in labor and delivery department. Currently, I'm working as a registered nurse midwife in Saudi Arabia. I would really like to help nurses, maybe the students or someone who prepare for their exam like MOH, Haad, or DHA. I'm sure that I can help you. I have given my Telegram group link down here for downloading the notes, mostly related to the topics which I take. And I think this will really help the students who are backlog and currently working. If you are not a nurse, kindly help by sharing this video. If it reaches someone who really in need, maybe this will benefit. I will also upload the explanation in my native language, that's Malayalam. So I hope this will be really helpful for those you are really in need to be get studied. Thank you. We will see for amniotic fluid. So what is amniotic fluid? It is the protective liquid. Okay, while studying, you should see the main words. So you can connect that while you are filling in your exam. Okay, so it is the protective liquid by the amniotic sac. So the next word is amniotic sac. The first, I'm sorry, this is AMNIOTIC. First word was protective liquid and the second word is amniotic sac of the gravid amniole. What is that gravid amniole? Like in the uterus. Okay. So this fluid serves as a cushion. This is a word, cushion for the growing. So this sign just sees as growing fetus. Okay. This helps or serves as a cushion for the growing fetus, but also serves to facilitate the exchange of nutrients. So I will show one image. Okay, this is the picture of a baby. There is a placenta. This is covered by amniotic fluid. So what things can happen here? One, what all are the functions? So we'll just see the functions. It serves as a cushion. Okay, so it helps from the jugs and shocks from the outer side of the womb. The second thing is it facilitates the exchange of nutrients. It facilitates the exchange of nutrients. Nutrients, not only the nutrients, the water and the biochemical products between the mother and the baby. Okay, hope you got it. So I hope you got about the definition of amniotic fluid as well as the functions of amniotic fluid. Next, I would like to tell about the contents. What all things are there as a content in the amniotic fluid? At first, it is mainly water and electrolytes. Okay, the water and electrolytes, and but in about 12 to 14th week, so 12 to 14 weeks, The liquid also contain proteins, carbohydrates, lipids, phospholipids, and urea. Okay, so from 12 to 14 weeks, it also contains protein, carbohydrate, lipid, phospholipids, and urea. So I would like to tell about our oleum. How much amount of amniotic fluid is there in the amniotic sac? Okay, so we can just tell when the fetus increase with their growth, the amount of amniotic fluid also will be get more. At the 10th to 12th week, the amount of amniotic fluid will be 25 ml to 400 ml. Okay, from the 10th to 12th week, the amount of fluid will be from 25 ml to 400 ml. So as the days pass, the amount of fluid also will get increased, and at the 28th week, okay, it will be around 800 ml. The amount of fluid will be around 800 ml. Then again the baby grows up on the 42 weeks. What happens? The amount comes to the reduction, like it reduce around 400 ml. It reduced to around 400 ml. So at the time of birth, the amount of fluid will be varies from 500 ml to 1000 ml. Okay, so next it comes the rupture of membrane. Rupture of membrane we can divide it into two, that is spontaneous rupture of membrane and artificial rupture of membrane. Spontaneous rupture of membrane, otherwise called as water breaks, which we can see normally. The patient may experience that even they are on their home, like it can all of a sudden it happens. Okay, so they will just feel like a flush of water from the vagina. And what is artificial rupture of membrane? So this is done by the healthcare providers, like especially by the practitioner, by the doctor, for the induction of labor. To induce pain, the doctor will do artificial rupture of membrane while like in between the induction of labor. Next, we will see the functions. First one is to create urine and meconium. So what is meconium? Earliest stool of an infant. It is composed of materials ingested during the time which the infant spends in the uterus. What all things it contains? It contains the intestinal epithelial cells, the lanigo. What is lanigo? The small hair which we can see on the baby's body, that is known as, actually not baby's body, the fetus body. And this will go by on before the delivery. If it persists even after the delivery, we can see in the small newborn babies there is a small hair like substance all over the body, but it shuts down automatically while giving birth or sponge or something. Okay, so it is not a complicated subject to be discussed. So we just taught so we are just telling about the lanigo. I just added here thin, soft, usually unpigmented, downy hair found on the body of the fetal or newborn human, normally shed before birth. If persist after birth, usually disappears within few weeks. So this is all about lanigo. The second one is protects the developing baby by cushions effect from the blows towards the mother's abdomen. So it is the outer effect. If the mother's abdomen get a hit by accidentally, it it helps us it gives a effect of cushion, like it can go backward or to the sideward, and it helps to protect the baby. The third one is allows easier movement and promoting muscular skeletal development. So the baby can move enough in the womb. So it helps to promote the development of the musculoskeletal system. Okay, then the fourth one is fluid swallowed by the fetus helps in the formation of the GI tract. So it helps in the formation of the GI tract. So the baby swallow this fluid. This will create the formation of the GI tract as well as the urine and the meconium. Okay, so this helps for the development of the GI tract as well as the musculoskeletal system. Then protects from mechanical jerks and shocks. Next one is amniocentesis. So what is amniocentesis? Amniocentesis, this is for prenatal diagnosis of chromosomal abnormalities and fetal infections as well as sex determination. A small amount of amniotic fluid contains fetal tissues is sampled from the amniotic sac surrounding a developing fetus. The fetal DNA is examined for genetic abnormalities. I would just like to add some more things, like other tests are chorionic villus sampling, percutaneous umbilical cord blood sampling is also called as cordosynthesis, or fetal blood sampling or fetal umbilical cord vein sampling. So these tests are also for to detect the fetal abnormality. So what happens in the percutaneous umbilical cord blood sampling? The cord blood is collected percutaneous, like the amniocentesis. The needle is injecting through the abdomen, and from the baby's cord, blood sample is collecting. Okay, so these all are just to detect the fetal abnormalities. Next comes the complication. Oligohydramnios, we have already discussed the amount of fluid lesser than the required amount is known as oligohydramnios. I will take a detailed section of oligohydramnios and polyhydramnios. If the amount is more than the required amount, so that is known as polyhydramnios. And what is amniotic fluid embolism? Do you have an idea regarding that amniotic fluid embolism? Okay, amniotic fluid embolism is the amniotic fluid enters the bloodstream of the mother to trigger a serious reaction, result in cardiorespiratory collapse and massive bleeding. So I have a detailed note here regarding the amniotic fluid embolism. I would like you to invite to the Telegram group, and there you can get all these notes which I have prepared. You can download the thing and study for yourself. Please share this video if you feel like this is informative to the friends or to the relatives, and at least let it reach some of the student nurses or the nurses who are preparing for the exams like Prometric, DHA, Haad. So this may be a review for their system. Okay, all the best for all the students. Thank you.